Hello viewers, I am Dr. Shailesh Kumar Garge, board certified vascular specialist and intervention radiologist at City Vascular Hospital, and I have treated thousands of such patients. So today I'll show you a case of live prostate embolization for benign enlargement of prostate. So this patient was 58-year male. He was suffering with multiple symptoms of the BPH, classical BPH, that is urinary frequency. So multiple times he has to go to the urination. He was not able to hold the urine. There was urine urgency, and when he's passing micturition, there was burning pain during the micturition. So he consulted his family physician, and on ultrasound he was found to have a moderate enlargement of prostate, that is benign prostate enlargement with 60 grams of prostate. So he was placed on tablets, medications for the BPH, and when he started using the tablets, he was developing a lot of side effects because of these tablets. And when the doctor had asked for surgery, so he wanted to avoid the surgery, but because of the side effects of the tablets, he was not able to continue with the tablets, and he continued to suffer with the prostate enlargement symptoms. So he want to get rid of the symptoms, as well as he don't want the side effects of the tablets. So he approached us, and we have advised prostate embolizing for this patient. And before showing you the live prostate embolization treatment, you have a look at the animated video, so that you will better understand this treatment procedure. So prostate is a small walnut sized gland just below our urinary bladder, and urine passes through the prostate. So when there is enlargement of the prostate, this tube get narrowed, and there is problem to the urine passage. So there is urine frequency, urgency, and the bladder get thick, and the patient has to wake up multiple times in the night to pass the urination, which will disturb the sleep of the patient as well as the partner's sleep. So this prostate artery embolization is minimally invasive, improves the symptoms of the prostate, and is usually performed by an intervention radiology through hand or through the leg. So once we reach till the prostate gland, the blood supply we identify, and these tiny particles are released into the prostate artery to block the prostate blood supply. And once the prostate blood supply is blocked, you will have a normal passage, and the pressure in the urinary tract is reduced, and life become better as previously to this prostate symptoms. So this is the animated video. So these are the catheters. Now you saw that we reach till the prostate gland, and prostatic arteries are very small. So this these tiny catheters we use to reach till the prostate gland. So this is the first, how in the animated video you saw, this is the DSA run, which is from the internal iliac artery on the right side. So this is the prostatic artery which is going to the prostate. This is the prostatic artery which is going to the prostate. Now we'll try to reach till the prostatic artery through the whatever the artery I have shown in the previous slide. So we have cannulated the prostatic artery, and this is the blood supply which is going to the prostate. So we'll try to reach as close as possible to the prostate, and we block the prostatic artery with slowly these tiny particles. So once we block this, now you see that there will not be any flow to the prostatic artery. So the prostatic artery is embolized using the PVA particles 200 micron, and now you see that there is no flow going to the prostate. It is stopped here only. There is no further flow to the prostate gland. This is on the right side. Now we'll do the similar procedure on the other side, that is left side. So these are the PVA particles, the small tiny particles which we saw in the animated video. These are 200 microns, so very small particles. So this is the particle vial which we'll be using to block the prostate, and this is our team which is doing the prostate blocking through this syringe and catheter which is already placed into the patient's groin area. So then we'll come to the left side. So similarly on the left side, this is the prostatic artery, Now we'll try to reach as close as possible to the prostate through this prostatic artery blood supply. So we have reached to the prostatic artery on the left side as well. Now you see there is significant of prostatic blush is there on from the left side as well. Now previously we have blocked the right side. Now this is the left half of the prostatic gland supplied by the left prostatic artery. So we try to reach close to the possible so that there will not be any reflex to the other areas. So this is the prostatic blush. You see this is the prostatic gland and this is the prostatic blush. Now we try to stop the blood supply to the left half of the prostate as well. And this is the tube which is we are you see we are slowly advancing as close to the possible to the prostate. So this is the one. You see it is moving ahead. So once we blocked with the same 200 PVA particles, now you see that there is no flow to the prostatic gland. Now the blood supply is coming only till here. It is not going to the prostate, which was seen previously in the before embolization. The blush was there, now there is no blush. So this is how the prostatic artery embolization is done. If you have any questions or doubts, please put them in the comment box. I personally read each and every comment and will try to answer them in our next video.